All right, it's 1:03, so we're gonna jump in here. Good to see you, Jens.
Good to see you, Rick.
So for our audience, to start, nice to have you. Thanks for joining. I'm Rick McCartney. I have with me Dr. Jens Härtel. I'm the CEO of Significo, where we're really focused on using technology to make healthcare more human. I'm a nurse practitioner by training, so my background is in community mental health and psychiatry. And a lot of my clinical practice was helping people to navigate living out their values and having their behaviors match things that are important to them. Really fell in love with the idea that we can use technology and other tools to help make that a reality for more people. And so that's what I focused the past nearly a decade on. Jens and I met 6 or 7 years ago. He's a physician by training, has been working in technology for many years as well. And so we work together in Germany. Now Jens is the chief medical officer for Significo, and we have a lot of fun together. We're looking forward to today and just the chance to explore personalization in digital health. And so that's kind of the big picture frame. Specifically, we're going to start with understanding personalized digital health solutions. So kind of learn current landscape, areas where we see opportunities, where we're at in healthcare right now. So we'll get into some of the specifics there. And then how we could potentially leverage personalized approaches for insurance organizations. And then we're going to talk about some potential implementation strategies and best practices. Finally, we'll talk about some ethical considerations and privacy, maybe kind of future issues. We will have some Q&A time. My style and Jens's style is for us to try to be pretty conversational here. We're going to give you these slides so you can follow along and know kind of where we are in the conversation. So if you're like us and maybe you have to pop in or pop out or watch something at 2x speed later, hopefully you've got some guide to understand where we are in the conversation. You can ask questions in the Q&A. If they're relevant to what we're talking about in the moment. We have some people from our team who can chime in and say, hey, why don't we take this question because it's relevant to the discussion right now. Otherwise, we'll just take them at the end. I'm going to actually start a little bit. So I talked a little bit about myself. And part of what I love about having some questions to start with is that we can practice those, and then I can ask totally different questions that make the conversation more authentic. So Jens, I'm just going to start asking you, like, how'd you get into technology? Like, why digital health?
Yes, it's a good question. I started 25 years before, where nobody thought about digital technology in healthcare, because there was a need from the patients to learn more about their diseases. And as a physician, I saw, well, there are no information in the market. And so I started the first online platform in Germany for healthcare information. And that was the start of a long career in digital health, and now for 25 years.
Nice, fun. So what's your perspective on kind of the current state of personalization in digital health?
Well, I think the current situation, we have a lot of digital offerings from also in the area of apps, but we have often the methodics that one size fits all. So you have one offering to all of the users, and if you have, for example, a need in diabetes or in yoga or anything else, and you have to search for it, and then maybe you have an app, but the app is for all the users the same. But the need is not that. So everybody needs specialized recommendations, and don't want to use a search and use for the specific needs.
Yeah. So as you were answering, like, I was imagining the conversation that my wife and I often have so oftentimes, like, once the kids are in bed, I'm done working and kind of clearing out emails, we'll kind of sit down on the couch and usually watch, some sort of show. And last night we had the experience where we had unknowingly finished Righteous Gemstones. and we didn't realize we were on the season finale, and there's not another season available. And so we go into Netflix and we're like, well, what do we want to watch next?
Good.
And you can pretty much know that if they're telling you there's a 90% or higher likelihood that you would like something, that you're going to enjoy it. Like, we've discovered a lot of shows and had a lot of good laughs and fun time with that kind of 90% plus likelihood that you'll like this, you know, because you also watch this, or because you binge watch this show, you know, season by season for a decade now. Any thoughts on why that doesn't exist in health? Like, why there isn't that level of like knowing someone, where you can serve up health content that is 90% likely that this is relevant for you?
Well, I think not really, because we have the same development in the healthcare industry, but the healthcare industry is really behind all other industry. Maybe because it's very regulated. Maybe there are so many stakeholders in the market, and maybe there are so many stakeholders that formally are in the analog business, and they are only digitizing but not digitalizing the business. So they are only bringing content into the web or into an app, but don't think about how to bring this to the customers. So that's the question that we have to answer. So, Rick, how do you see the scope of personalized digital health solutions evolving in the coming years?
So I want to answer it, but you said something that struck me, and I haven't heard you say it before, and I wanted to just pause on it for a second. Maybe some in the audience are interested in what you meant by it. But you said, I think you said, and correct me if this is wrong, is that health companies are digitizing. They're only digitizing and not digitalizing.
Yes.
Tell me a little bit more about what you see and what you mean by that. That they're only digitizing but not digitalizing.
Well, what do I mean? If we are, for example, looking at publishing houses, so they have tons of content, and how do they proceed them into the digital world? They are publishing the printed versions in the web. That's it. And they have all the content that also the patients needs. Yeah. So that's not very comfortable for patients or for users to use this content to read that in the web, what they already can read print. And even if we are looking at other companies, so if we are looking at companies that are producing apps, what they're doing? They are producing apps with content, and that's very analog. Most of them don't ask the users, hey, what do you like? What do you want to do? What did you do in the past?
So what I hear you saying there is that digitizing a process would be take it from analog and then create the corresponding digital version of it. So take your process, take your content, take your materials, and then create it. Same thing, but digital. And the idea of digitalizing is that you take a different orientation and different approach, which is analog, solve the problem in this way, take that same problem, maybe the learnings that you have from it, and imagine what would it be like to use digital to solve that problem. And there may be some things that you do similarly, but there may be things that you do very differently because you're on a different medium. You have different resources available. I think that that's really important. And I think for that the next question is, that you had asked was about personalized digital health solutions evolving in the coming years. And I think, in my opinion, it really takes using that perspective of what are the right solutions now that we have all of this digital stuff at our fingertips. the like clinical analog that I can think about is one of the community mental health centers that I worked in for many years. By the front desk, there was like the pamphlet station, right? And it has all the different pamphlets that people may have and that are relevant for them. And there was an element of personalization, which is that I could walk with my patient over to that and say, this is the pamphlet with the information that I referenced. We talked about these things in my session. Here, take this with you. This is for you. But if I didn't do that, then the experience was, here's the rack of the 30 or 40 different things that span from, support groups to events going on in the community to stop smoking to, managing living with a loved one with schizophrenia, right? Like it could be a whole broad spectrum of different things. Whereas with digital, we don't need to, just like Netflix doesn't show me every possible available resource that they have and say, pick one. They get to know me and my preferences. I think that that's going to be an important part of it. Something that I think will be really fascinating to see as well is the ability of machines to recognize patterns really, really early on. So something that's fascinating about humans is we're good at establishing and seeing patterns, so much so that you could show us like random points on a page and we're going to probably try to make sense of it and see something there, right? We're very good at finding patterns and seeing things. But computers are phenomenal and really fast at seeing very early on what are the early signs that X is developing. And so I think how that relates to personalization is the ability to get to know somebody a little bit, but then be able to say, I think there's a pretty good chance this person might also be like this, or they may also like this, or they may also have these risks. And so being able to do quick lookalikes and say, this is something that's likely to be relevant to you based on what we know about you so far. If we had to fill in the blanks, we'd guess that you're also like this. And so humans do that really poorly because we make generalizations and we like over recognize patterns and saying, okay, this person looks like X other person I had a relationship with. They probably also have the same personality, or they're probably also going to talk to me in the same way or interact with me in a certain way. And so that can create, implicit bias that we have, and that can be a really negative thing. Whereas I think machines have the ability to be used at stripping away some of that bias. I think there's risk in there. I think we talk about later some ethical considerations. You can also teach machines bias. So I think we need to be careful about that when we are creating machine learning models. I think that it's going to be very important to make sure that we're using diverse data sets and that we're really being careful about not training AI to be racist or to be, inconsiderate of the socioeconomics and, social determinants of health that could be in play for any individual. But I do think digital solutions can provide faster, more precise personalization, and we can use what we know makes people feel special as humans, and then deliver it in a digital way that helps people to feel that what's in front of them is really relevant and the best value for them. Other thoughts about, so do you have any other thoughts about kind of big picture personalization of digital health solutions?
Maybe I can make another example why healthcare is not working very well in this field. So if you are thinking on the maps years before, everybody has a map, a printed map in the car, and drive with this car. That it was fine. Yes, everybody is knowing where to drive and where's the next station or the next town. And then there was something in the air, digitalization, and to make everything digital, and all the publishing houses digitalized their maps. So you have all the maps digital, and you can read it digital, and maybe you can plan your route before you are knowing how to get fast to your next city or to home, but nothing else. And why did they fail? Because there was not a really value for the users, and they don't accept that they can get a lot of data from the users. So Google and Apple, they started, so Google first, with interactive routes and cards, and they are driving in all the streets, and everybody said, hey, why are they driving in all the streets? So it's very expensive. Why do they do that? Yes, so that's was everybody laughed about this in the beginning, and at the end, everybody is now using Google. Why? Because if I'm on the road, I get the next information in real time, and nobody is doing that in healthcare. So giving me the right recommendation at real time. So I'm in a situation and I'm feeling bad, and well, will be my next offering for that? So then I can go to an app and I can research and do this and that, but nobody is asking me, but I have a lot of data. Yeah, it's curious. I have a lot of data at my physician, in my app, in my yoga app, and all these things. And if we are using this data, then the recommendations will be really precise, like Google doing it in the map. Yeah, and that will be the big difference in the future.
So from your perspective, what are the risks or downsides of the healthcare system using kind of static and outdated data? So if they have, my healthcare providers have data on me from the last time that I saw them a year ago. What are the risks related to that? Like, what happens if we continue down this path and healthcare only has kind of stale data on its people?
Well, we are very slow. We are not precise. So we have only the data from years before. And if I'm a physician and you're coming to me, then I'm asking, hey, what's about now? And you will tell me about your problem now. But I have no information what was in the past. And that's also very important for me. So the current situation and the past and your whole history, but nobody is referring to that. Every physician is only referring to the current situation, and the people are visiting a lot of physicians, and there are a lot of information in the world, but nobody is combining the information and using it in a very good way. So what is the risk? The risk is that the patients won't get the right therapy. The risk is that we are missing a lot of chances in prevention. Nobody is using prevention now, because if we are using prevention in the right way, then we can postpone a lot of behavior indicated diseases years later, or even avoid them.
Is there an example that you can think of in healthcare today where it feels like, real-time data or faster kind of machine-based decision making is producing value?
Yes, of course. So I think in the radiology, we have the situation already, because all the radiologists are using the AI and using the decision making of the machines, because we have thousands, millions of images in radiology, and the machine learning is really, really precise. And I will give you an example. I was at the Congress. There was a radiologist, and they are also using AI. And he said, please do not trust the physician if the physician making the decision for you. Trust the machine. Why? The machine is using millions of data, and it's really 99%. right, and not only 80 as a physician. And he said also, well, we are experimenting with not using any inflation of contrast for the radiology, because the machine is also able to give me the right recommendation, even if I only use a few or nothing, because the machine have all the data. And that's a good example. And there we are really good and really, yes, in our current situation, where all the other industries are. So if we are using this methodic in other medical and prevention departments, it will be great.
Have you had imaging with contrast before?
Me?
Yeah.
No, but I'm knowing it's not fun.
Yeah, I mean, I've had it twice, and man, I really would have liked if I didn't have to have contrast at those two times. One of them was totally my own doing. I was volunteering. It was a research study, and there was going to be it was fMRI with contrast, and so that was administered. I think I don't actually remember. I might have had it 3 times. I think I know I've had a heart PET scan before where I had to have dye. I think I've had an fMRI with contrast. And then I had imaging of my shoulder when I tore my labrum 3 years ago. And they had to inject into the joint, which was of an injured shoulder, which was quite uncomfortable. And the first 2 experiences were through an IV, and so you feel your whole body kind of gets flush. Your face turns, or my face, I'm kind of pink skinned anyway, but face turns red. You feel warm. You know, there's all this sensation to this contrast. And then yeah, a big needle kind of into your shoulder for it was also quite uncomfortable. And it was like I had to have that done and then immediately move to the other building to have the imaging within 90 minutes or something. Big pain. So the idea that, you know, technology could get to a place where it's so much better at recognizing patterns that need for contrast is reduced or eliminated. I like physically feel a relief in thinking about that. So that's a fascinating example. So where does insurance play into all of this? I know that we're kind of speaking from somewhat different environments as far as insurance companies, but where do you think that personalization and technology plays into the role of insurance companies in helping provide and pay for healthcare for people?
Yes, so it's all about money also in insurance companies. So the insurance companies really want to save money, and well, it's really hard for them to get the right starting point because they are not familiar in producing digital solutions. On the one side, they can use it for administrative things, and so for paying invoices, reading invoices, and so on. That's already in place, and they are doing a good job there. But on the other side, at their members or at the patients, they are really not good. But if we are looking at the solutions that are out in the market, and if we are looking at what we did for one company, there is really room, there's really space where they can step in, because they have a lot of offerings, and if they provide the right offerings to the right people, then there will be a really benefit for these people. And maybe they are motivated then to living a little bit healthier, and then the cost decreasing in the insurance company. And we have to address the motivation of the people, the motivation of the members of the insurance company, and we have to give them the right recommendation what's next to do. And in this way, the insurance companies can do a lot. Maybe I make a little example from another industry, because I worked a lot of years for a big service provider in the telecommunication. And what are they doing there? They are thinking every minute what could be the next best offering for my customer, and they are looking of the behavior of the customers, and then they are offering the next best thing that he can buy, what she can buy. And that could be also a solution for health insurances. Hey, what's the next best offering in this situation for your insured people here?
Yeah, I think there are two things that came to mind as you were speaking. The first one that I can't help but think about is like the role of insurance companies and how they've historically used technology. And a decade ago, when I first started having conversations with health insurance companies about technology for health improvement or for primary prevention and things like that, I would always ask, like, well, what initiatives is your company investing in right now related to technology? And they would get, like, their eyes would light up, and they'd tell me about the software that's making invoice management and claims payment automated, and that's helping them early detect signs of fraudulent billing or practices that are falling outside of the norm as far as what kind of procedures they're running, help them analyze an invoice to see, does the procedures that were administered match the standard of care that's established for the procedures that could be administered. And I had this moment where I realized, like, I'm talking to an insurance company, right? I think we can think about them and say, oh, like, they're healthcare providers, or they facilitate the navigation of health for all of their members. And I do truly think that most of them exist because they care about people getting good, relevant care. That's, and there's a lot of thought that goes into creating good provider networks and other things. I think that there's a desire to kind of help people along that journey. But at the end of the day, they are also insurance companies. They want to reduce risk. They want to underwrite risk really fast and understand what could be coming up that could cause them to have a lot of outgoing claims needing to be paid. And so a lot of the investment in technology was really focused in those areas. And so from my standpoint, I think that means that we need to, one, understand what are their priorities, what are the things causing them pain, and then make sure that that we can tie personalized approaches for using technology to those underlying company objectives of understanding and mitigating risk, providing good value without overspending, or providing things that aren't needed or aren't going to make people healthier. And so I think there's kind of two sides to it. One, the industry must get to a place where they have that Netflix-like experience of using technology in a way that is relevant and meaningful for people. But two, you need to understand what the customer's objectives are. And we need to make sure that we're not saying, hey, spend more and provide more care and provide more resources. It's kind of being really precise about who needs those resources. How do you catch them at the right time? How do you do things that help move the cost needle as well? Because it's not just all about providing value. It's really about being targeted in mitigating risk as well. So I think that is going to be essential, and it's something that I think we need to be really thoughtful about. I said there were two things that I was thinking about, and I forgot the second one. So it clearly wasn't that important, and we can skip over it. We're at about 30 minutes here. I know we said we wanted to spend about 40 minutes in discussion, and then open it up for some questions. I think something that's super important, and I'd love for us to shift to, if you're willing, is kind kind of ethical considerations and privacy protection when it comes to personalization. So what tips or advice would you have for healthcare organizations that are thinking about providing more personalized healthcare, but doing it in an ethical way that protects people's privacy?
Yes, I think that's really an absolutely important point here that we have to figure out. As you know, I'm loving to personalize services, but I'm also loving to protect the privacy of each person here. So what I want to recommend is that we really use a strong data privacy policy in the companies, and that every patient is, or every user is aware which data are we using for what and why we are using this data. So to be absolutely transparent to the user is really one of the most important things that we have to do. The second thing is that that the users don't have to think about, hey, if I'm giving this data, maybe I will get a higher insurance rate or something else, because if I have a disease, and maybe the costs are higher. So this data could be maybe also at a third party, the personal data, but the aggregation and the anonymization of the data could be in the hand of the providers. So that's possible, and they get a lot of data and a lot of results out of this data, even if they are not individualized and personalized, also from the aggregated data. So that's the most important things of what I want to recommend here.
Yeah, I think as you were saying that, I was like having flashbacks to trainings on data privacy, and especially in hospital settings and things like that. And the line that kind of stuck with me is like, you can't leak data that you don't have, right? And like you can't misuse data that you don't collect. And I think for technology companies, we need to be really thoughtful and really careful about, is this data required in order for us to deliver value? Or is it something that we're collecting just because we collect it, right? Like anonymized research study surveys that you're handed in a clinical setting don't have to have your name on them, right? Like if it's going to be anonymized, it doesn't need to have patient name and date of birth on it. There are other ways that you can abstract away from that, and not have the risk that someone's personal identity is being tied to these issues. And actually, one of the engineers that I worked with for many years was really good at kind of stripping out all of the unnecessary things and saying, you actually don't need this, you don't need that, you don't need that. I think IP address was one question that came up, and like you could conceivably get to know some more information about a person or where they are from their IP address. And we wanted to protect people against that. But we also wanted to know where they are, so that we can make sure that the things that we were putting in front of them were really relevant. And so his solution was, well, we can like read the IP address, we can abstract from that, get an idea of the location that somebody's in, we can store the location and not store the original IP address, and then we have the need met that we wanted met, but we've protected this person to a greater degree by not storing their IP address. I thought that was a really thoughtful way of saying, hey, let's take the extra step in order to make sure that we are infusing protection for the individual into everything that we're doing. And it takes time, it takes money, it takes thoughtfulness to do that. But I do think that if you want people to trust technology, it's going to be essential. That I've had I had someone tell me a horror story a couple weeks ago of they were being interviewed by a health plan that they were trying to get direct. They're trying to pay for their own health insurance plan here in the US. And so they were asked, have you ever had this issue? Have you ever had this issue? And they're like thinking back to childhood. Oh yeah, I was, went to the hospital. They thought maybe I had asthma, and like just really giving a comprehensive health history. And then like 2 days later, they hear back, sorry, you've been declined for coverage. Like, we can't cover you. And they're like, thought that they were being transparent and sharing everything. And they didn't know that most people will say, nope, no history of that, no history of that, no history of that. Like, just move through everything. And, if there's, yeah, a broken bone once upon a time, fine. But the idea of disclosing that you've had a chronic health issue in the past, even if it's fully resolved to insurance, can feel like a trap. And so I think, yeah, personally, I'd like to see insurance companies be able to build some credibility around creating safe spaces for taking in data, so that people don't feel that it's going to later be used against them, right? I think that'll create greater value creation. Are there any specific like practices that you'd like to see healthcare organizations put into place in order to maintain transparency and build trust with their employees?
Well, yes, I think if we are put in the tools also for employers and employees, they need to know, what are we doing here? Why do we need this information? And really give the employees right or good recommendations, and not only give them, hey, here's a catalog, you can choose everything what you are doing here, because that's not really a value for the employee or for the employer, because the most people using this are very healthy people, and we are and the employees are interested in not in healthy people, in people with a risk, not in really people that already have a disease. They have to be in the healthcare system. But there are a lot of people that really have a risk to get a disease, or to be demotivated, or to have a mental health problem. And we want to address them. And how could we do this? So we have to do a assessment, a very short scientific assessment, where we get some information and not all. Because if you are using 150 questions, then nobody is using it. If you are using only 10 or 12 questions in the beginning, you will get so many information, so you can give really good recommendations on that. And then next session, you will ask some more questions, and that's really helpful. Not to ask too many and want to get too much information from your employee. But if you do it step by step, then you're doing a good job here.
What I hear you saying is kind of taking people along with you, and kind of start somewhere, start simple, collect more information as you go. As you were talking about, that kind of start simple with an assessment and move on from there. I was thinking about a friend of mine shared a probably uncommon, if not unpopular, opinion that like data consents should be totally overhauled. And right now, because of GDPR and the California privacy rule and HIPAA and a number of different things, you have kind of approved language for how you notify people about their rights, what you include, what you need to disclose, what you need to record them saying, yes, I've received this and had a chance to have a copy of it. And unfortunately, so much of that information is not very easily understood by someone. And so he was proposing that you basically need a dynamic process of informed consent that's more similar to what you may do in clinical practice. You know, if I'm sitting with a patient and I'm talking about a certain treatment modality or medication or something, I have to tell them about the benefits of it, why I recommend that for them, what potential side effects to look out for. I have to document that I've informed them about any black box warnings that exist for a medication. And it's a conversation. And we're kind of back and forth saying, you know, and I'm leaving space for questions, and then we're getting through it. I think something that hasn't yet really translated well is that experience of making sure somebody understands something, that you have a sense of their comfort level, and then you can kind of continue to go along. Instead, we oftentimes end up with just these really long consents, and people scroll to the bottom, they click accept, they move on, because all they really want to do is see what the product's about. And I think it strikes me that cracking that could help people to feel like they're more in control, and that they have an ability to understand things and then trust things as well. And so I think building trust is going to be essential, but I think we need to humanize that process a little bit and think about how do we break down what data we collect, why we collect it, what it's going to be used for, what we do with it, in a way that's not just a legal document. Do we have any, Adrian, do we have any questions from the audience? Do we have anything that people would like us to speak to? Anything that stood out during this discussion where you say, hey, I'd really like to see you talk a little bit more about X? Feel free to read it out if you can't share it. Okay.
Okay. In the context of personalized healthcare, how can organizations strike a balance between providing tailored services and safeguarding sensitive data? I know you guys talked about that a little bit, but can you expound on potentially when tailored services are provided, what is useful and safe for healthcare organizations to ask for and share, and then just some more, can you expound a little bit on what should be safeguarded?
Jens, I don't know if you have any specific thoughts on it, but for the first thing coming to mind for me is making sure that, one, you've communicated the reason why you are asking for some certain sensitive data. I think, you know, as a nurse practitioner, I can't do my job without asking people uncomfortable or sensitive questions. They didn't come to me for a coffee. They're there with real problems, and they're willing to share details about that if they know that they've come to the right place and they have a potential to get benefit for that. And so I think leading with, hey, this type of information will help us to be able to do X for you. And this will not be stored along with any personal identifiers or any protected health information. You know, it's going to be safeguarded in X kind of way. And so I think just really being clear about why you need the info, what your rationale is, I think, and then being really selective. So we had an issue early on with a product that we built where, you know, in order for us to make, you know, a fantastic assessment for people, we needed them to answer 200 questions. It was like, it's just never going to happen. People don't have time for that. They don't care about our kind of academic approach to doing that. So we got to figure out how do we get people to see why it makes sense for them to engage in this journey of sharing information and then getting value back from it. And then I think some of it is policy based. So when you have policy that enforces rigor around how companies are storing data, what controls they have in place to keep people from accessing that data and doing malicious things with it, And then you have follow through, where organizations that have a breach or leak data or were sloppy around configuration have real consequences, in that they have, commercial consequences where companies are unwilling to work with a company because they had this, misstep. And then also authorities assessing big fines and corrective action and damages for how to make sure that people are taken care of in the event that their data was lost or compromised in some sort of way. So I think you need to have you need to treat it seriously, treat people with respect in how you ask them for things, and then make sure that there are real consequences when people don't play by the rules, which will hopefully elevate the level of play as opposed to cause more people to decide to sit out that game. Jens, I don't know if you have any thoughts on that specifically.
No, I think nothing to add here. You mentioned all the things that I'm also thinking about.
I'm going to ask you the anonymous question we got in the Q&A. As you mentioned, fostering trust among employees and members. Could you elaborate on strategies that healthcare organizations can employ to build and maintain trust while implementing personalized healthcare initiatives?
Well, yes, I think we mentioned a little bit before to be here transparent, and so if you are using, as you said before, questions and exploring and explaining why you use this question, why do you want to know this, and make that very clear, because we want to know because we want to help you in this or that. Then that's building a lot of trust. And if you are saying, hey, we are using these and that for data privacy, and we are anonymizing your data, or we are doing this and that would be also very helpful. So you can do really a lot to create trust. And if you are also using your if we are thinking on a company, then it makes no sense if the senior management is saying, hey, please use it. It has to be invite all the middle management. It has to be convinced the middle management. It has to be explained, hey, we are using this because we want to reach out this and that, and these are our goals. And if the people are talking positive about your things that you're doing, then that's the first step. So it has to be a mouth-to-mouth propaganda in the company, or maybe also if we are thinking on other things in the chat or in an open discussion, and that will be very helpful if the people are talking about positive about what they are doing here.
Yeah, as we're answering that, I was thinking about this like tricky part of trust and risk in healthcare, and something that is pretty relevant in my field in psychiatry is the times when you may have to break confidentiality. So when I, do an intake with a new client, I need to share with them, here's the rules of how this operates. Here are all the things that are confidential, that I will stay between us, and either I will abstract away from when I'm writing notes. You can talk about what you did in the session without sharing every detail that a person has shared with you. But then I also need to be upfront and say, here's when I may have to break confidentiality. If you tell me about the abuse of a minor or an elderly person or someone with disabilities, if X is happening, or if you are having these certain safety concerns, then, and here's how that would play out. Here's what I would have to do. Here's what would happen as a process. These are the people that would be involved. This is kind of how that goes. And that's because I need to protect you and others in society, and I need to protect myself and my livelihood and my experience of providing care. And so letting people know what are the risks, what are the warnings, what are the things that, do cause an escalation. Because I've only heard horror stories when that conversation doesn't happen early on. And then you get into a situation where you have to report something to a government agency or something else, and it impacts the patient in a really, intense way. So I think part of building trust is also being honest about what happens when things don't go well. What kind of things will result from this, and making sure they're okay with continuing to engage with it. The question was, can you provide insights into how healthcare organizations are effectively communicating the benefits of personalized healthcare to their patients and members to encourage participation and engagement? Effectively communicating is really hard in general. So I can tell you some of the ways that I see it. I get emails regularly from my insurance company telling me the things that I have that I could potentially sign up for. Some of them claim to bring more personalization to me. I have not seen, personally, I've not seen a whole lot beyond my insurance company showing up in my email inbox. That is kind of like, hey, you have this available to you. I have registered for some of those tools in the past. I have not. One of the challenges to that is that it's oftentimes a single sign-on through my insurance platform, which I do not go sign into my insurance platform with any sort of regularity. It's just not kind of part of my normal rhythm. So it's unlikely that I'm going to go sign into my insurance company platform and then kick into the, well-being offering or the other tools that are in there. So I think that might be part of the challenge. I do think there are some companies that just offer access to a tool, and that tool may have more personalization within it. But yeah, I think there's a long way to go with how healthcare organizations communicate to all the different people that they are providing care for. Jens, I don't know if you have any thoughts on that.
Well, no, we have one more question, Rick, here. So what recommendations do you have for healthcare professionals or individuals who want to stay informed and make informed decisions about their involvement in personalized healthcare initiatives?
Ooh, follow along.
Follow
I
us.
mean, yeah, no, I would say this is something that I care a lot about. And so we look for partners that say, hey, we're looking for how to tackle reaching difficult to reach people, or we have a really good audience and they read our stuff, but we don't really know how to like better engage them. So like I would recommend if you are like, if you're in this space and you want to stay informed, pay attention to what's going on. If you're a healthcare professional, use LinkedIn, follow groups that are talking about this stuff. We post about, share about, reshare things regularly. You can sign up for newsletters of companies that are going to be regularly sharing kind of what's going on, what's up and coming. And then you can ask your employer what they're doing in order to make your employee well-being product take better advantage of available technology or become more personalized. I think pressure from individuals to get their technology act together is going to move things substantially for employers, for insurance companies. Ultimately, they're going to be doing the things that they feel are being demanded. So I would encourage people to keep high expectations, the same expectations you have for Netflix on how accurate its recommendations are going to be for you. Like start bringing those expectations to the technology that you interact with in health. And I think that will cause you to pay attention to who's doing it well, who's not, what's available out there. But that's the journey that we're on, is trying to figure that out and trying to experiment with different ways of doing it. How do you approach people at the right time with the right initiative? So, if you figure it out, share it with us, and we'll follow along as well. All right, we're at time.
That's all we've got.
I like to end on time, so let's end. And thank you all for joining. Super glad to do this. Jens and I really like the kind of talk back and forth and bat around questions. So we're definitely going to try this out and see if it is meaningful for people. And if not, then we'll just resort to our regular virtual coffees. But nice to see everyone. Thank you.